Ever wondered why some women leak urine or even feces after delivery? Juliana Ome is the name. Vesico Vaginal Fistula is the topic. By the way, thank you so much for always making out time to get the right information on improving maternal and child survival. I won't be doing this without you, so you know you're special to me and I love you dearly. Let's go. Vesica is the Latin word for bladder. Vagina is a part of a woman's reproductive system where a baby will pass through during childbirth. O is a linking alphabet, and fistula is an opening, a hole. So vesico vaginal fistula means a hole between the bladder and vagina. VVF. This does not make sense, right? Don't worry. As we go on to make sense, just follow me. There are different types of fistula: vesico vaginal fistula, rectal vaginal fistula, and so on. Rectal vaginal fistula as well. The commonest is vesico vaginal fistula, VVF. This is an abnormal opening between the bladder and the vagina that allows continuous leakage of urine into the vagina. In the developed countries, VVF occurs due to unintentional injury, bladder injury, following gynecological operations. While in the developing countries, different things cause VVF. These developing countries of the world are areas where the culture encourages marriage and conception at an early age, usually before a woman has fully developed her hip bone. It's also a place where there is chronic malnutrition, which reduces the growth of a woman's hip bone, thereby increasing the risk of a distortion between the baby's head and the woman's hip bone, as well as causing malpresentation. And again, in these areas, few women attend hospital during childbirth and they are left in labor for many days. Then other causes will include operative deliveries, like the use of special instruments called forceps when a woman is delivering her baby. Then gynecological operations like removal of the womb. Then harmful traditional practices like female circumcision. Some tribes refer to it as gishiri cut in their local language. Then infections of the woman's reproductive tract. Then cervical cancer. That's when there's cancer in the cervix. Cervix is the part of the woman where the baby will pass through. When there's cancer there, it can cause VVF. Then, of course, exposure to radiation. For the purpose of this health talk, we shall dwell on the VVF that occurs following prolonged obstructed labour. So what happens is this. I want you to picture a basin. Now look at my hand. This basin represents a woman's hip bone. And within this basin lies the bladder in front, the uterus, which is as the vagina in the middle, and the rectum behind it, and then other structures around them. Right? Very good. You remember that health talk we did on vaginal health, where I said that the vag is positioned between two exit points for waste products, the urethra in front for urine, and the rectum behind it for feces. Great. With that explanation in mind, by the way, the video I'm referring to is on my channel, Juliana Ome on YouTube, and the topic is vaginal health. Now, with that explanation in mind, apply it here. The uterus is between the bladder in front and the rectum behind in this basin, and they're all housed by the hip bone, this basin. So when the woman is in labor, the baby literally pushes itself through the vagina. And if for any reason the baby is unable to pass through this passage, for example, a female is married off as a child and her hip bone is not well developed for childbirth, during delivery, the baby may get stuck inside this hip bone, inside this basin, and just the baby will stay there for as long as it takes until help comes. This will cause damage to that part of the bladder in front or the rectum being compressed due to pressure necrosis. To explain what pressure necrosis means, if, for instance, you tie your finger firmly with a band, after some minutes, the place becomes painful, and if it stays longer, it feels numb, and then it changes color. And in extreme of cases, the blood supply is permanently cut off, and that part of the finger dies off. This can explain the concept of pressure necrosis. Necrosis means death, so death from pressure. The head of the baby compresses the vagina against the bladder and the rectum, and then this tightening cuts off blood supply. And since oxygen is carried in the blood, so there's no oxygen supply to that part, so that part of the bladder or the rectum dies off. This happens especially when a woman labors at home or in a traditional birth attendant home for too long. Sometimes a woman is in a torment called labor. She's not taken to the hospital. Her bladder is filled with urine and is being compressed by the baby's head. You will agree with me that the importance of a woman laboring in the hospital under supervision cannot be overemphasized. Mind you, a midwife or a doctor only needs to look at the abdomen of a woman in labor to notice that the bladder is full, and they know what to do to relieve the tension immediately. Now, because this pressure is maximum from a particular part of the baby's head, known as presenting part, the necrosis, the death, occurs on a particular area on the bladder, and then this leads to pulling off of the tissues or sloughing off of the tissues, and then a hole is created. This hole is what we call a fistula. So if this hole occurs between the bladder and the vagina, it's called Vesico Vaginal Fistula. If it occurs between the rectum and the vagina, posteriorly at the back, it is called a recto-vaginal fistula. And the vagina is not built to hold urine or feces. So the sphincter that helps a woman hold urine when she's pressed, is not in the vagina, it's in the urethra. So once urine or feces leaks to the vagina from the bladder or the rectum through this hole created, the vagina pours it all out and it cannot be controlled. So the woman goes about with a stench until a repair is done for her. And then the patient presents with uncontrolled leakage of urine to the vagina, urinary or stool incontinence, bladder infection, cystitis, fever, foul smelly discharge, bad odor. Sometimes a fistula can close on its own, especially for very small fistula. But for the treatment of fistula, the patient needs to be admitted into the hospital and prepared for a surgical repair, an operation. So what that means is that VVF can be repaired. After a successful repair, the bladder is allowed to heal. The patient is placed on urethral catheter for 2 weeks. A catheter is a rubber tube that helps to empty the bladder of urine. So once urine is formed and gets to the bladder, the catheter empties it into a bag connected outside the body, so the urine does not enter the vagina. Then fluid intake is encouraged up to 4 liters a day, and the woman's bladder is frequently emptied of urine. She will also be on medications like antibiotics that will help the bladder heal. And she will also need physiotherapy, a special kind of exercise to help her regain her control. Now, at the point of discharge from the hospital after recovery, the doctor will give the patient some instructions like avoid sex for a few months, go to the hospital for family planning, go to the hospital when next you're planning to get pregnant for, preconception care, go for antenatal care when next you're pregnant, and then delivery should be by CS, then tell others about your cure. Now, what are the consequences of VVF? Emotionally, the patient might suffer anxiety, depression, worry, frustrations, and all that. You can imagine leaking urine or feces. Then social problems like divorce. Do you know that 80% of these women with VVF are divorced by their husbands once they develop the condition? Some of them are treated as outcasts. They are excluded from religious activities, separated from their families and other communal activities. They become destitute. They are walking about due to rejection. When you see them on the streets, you think they are mentally challenged, but they are not. Some even go into prostitution just for survival. There's worsening poverty, there's malnutrition, they suffer. It's almost an unending suffering for the woman. Now let's look at the prevention. The first thing is safe motherhood strategies. This will include social equity for women, antenatal care services, essential obstetric care, family planning services, and all the available care for women. Make sure that hospital is adequate, affordable, and accessible so that women can go there for delivery when they're in labor. Then provide transportation system to transport women in labor to the hospital, especially women in the villages, the rural areas. Then social and health reforms like education for all, ban early marriage, ban harmful traditional practices like female circumcision, health education to the public like what we are doing through this channel. These are the things that will help prevent VVF. Now, why will anybody be made to go through all these complications in the name of childbirth? In the developed world, these things are not heard of. And what that tells us is that VVF, following obstructed prolonged labor, is stoppable. We can eliminate its occurrence. Cultural practices like child marriage must be discouraged. Why are we in a hurry to make these girls to start performing their reproductive functions that their minds, their bodies, and psychology say they are not ready for? Their counterparts in the developed world are studying, discovering themselves and the world around them, and creating solutions to problems, while some persons in other parts of the world are hurrying these girls up into family lives that they are clueless about. And when problems like VVF happen, they divorce them as quickly as they married them and leave them to perpetual suffering. We can do better, right? Of course, if we know better, we'll surely do better. Please, the girl child should be seen as a normal child, and she should be given equal exposure, empowerment, and care as her male counterparts. Please, decision makers, policy influencers, fathers and mothers, help our girl children. Give them the care that they deserve. Now, since we are discussing VVF following prolonged obstructed labor, that means if we can prevent prolonged obstructed labor from happening, we can successfully prevent VVF and other complications. So everything we said in the Health Talk video for prevention of prolonged obstructed labor should be put into practice. Then say no to traditional birth attendants, the TBAs. Say no to TBAs. Amazing mothers, listen to me. It is your right to have the best care during pregnancy, childbirth, and always. Go to the hospital where you will get the best care. Nothing short of it. Remember, the sun should not set twice on a woman in labor. If a woman enters into a true active labor in the morning and she's still in labor by the evening of that same day, that woman should not be allowed to be in that labor by the next day, please. She needs help. Save her. And just for emphasis, if you're suffering this condition, VVF, or know anyone who is, help is available and accessible. Go to the hospital and be taken care of. And of course, after you've been treated, make sure you go for preconception care when next you're trying to get pregnant, and tell others about your cure so that they can come out and be treated. Now, message to our fathers. In fact, message to parents. I want to especially thank all the fathers and mothers out there that give their girl child education and exposure. And I also thank everyone who from this day on will make the decision to send their daughters to school and not to allow their fellow man to mortgage the future of their girl children, all in the name of paying you dowry or giving you a cow. Please, I encourage you, take this decision today and you'll be proud that you did. I remember a trend some times ago on social media of Linda Ikeji, a popular Nigerian queen and celebrity blogger, flying her dad out in a private jet for the first time. The sight of that brought a glow to my eyes. You see a man who understood that a girl child is a blessing and not a curse, and gave her education and exposure. And he sat in that private jet proudly with his plum, a great woman by all standards, feeling so fulfilled. By the way, shout out to all the great women out there and to their fathers. So together, let us empower other girls, speak out for them and help them. And please, someone make sure that Linda Ikeji sees this Health Talk, okay? Yeah, right. So that's it. Thank you so much, and please share this Health Talk video on all your platforms. Subscribe to the channel and click on the notification bell so that once there are subsequent uploads, you'll be notified immediately. Once again, on YouTube, Facebook, and LinkedIn is Juliana Ume. My Twitter and Instagram handle is @juliana.ume. Thank you very much and see you again.